Yes, thank you, Tommy, for the introduction. I'm very happy to be here and to see you. You must be very, very enthusiastic about this event. You have been, some of you already a few days, and now these 2 days again. And Tommy has got and Aya this program, so we tried to find something new for you also to take back home when you leave tomorrow or on Sunday. The Sir Peter, or Peter Morris, professor from Oxford, kidney transplant man, he wrote in the New England Medical Journal, one of the #1 journals in medicine in the world, an editorial which said that, well, transplantation is a medical miracle of the 20th century. And those of you who have undergone transplantation, I'm sure you agree in some way. This one I showed 2 days ago when at the workshop, and we can't forget this man, Taffy, Maurice Slapak, who organized the first World Olympic transplant competitions. Was it 78 or something? He's even older than me, 10 years older, and we used to have played tennis for about 40 years, and we still do. And you can take my word for it, he's a tough player. Very tough on the court, as one should be. So I got his, to convey his greetings to all of you also when I discussed with him by phone some time ago. As a doctor and a surgeon, I would like to recall to you a thing which all the transplanted attendants know very well, that you have all been transplanted for a very, very severe disease. It may also cause damage to other organs, which might be transplanted at the same time or later. But you have suffered from different kinds of common diseases for all of you. Infections, maybe hypertension, maybe cancer, and maybe in the end also some fragility. Nothing works quite well, if I could explain that in Finnish. Anyway, we actually, you have been checked for at least 5 organs, the main organs who keeps us alive. The list is clearly longer, of course, but it's the heart, kidney, liver, lung, and brains who decides a lot before and after transplantation. The previous diseases you have had are treated, of course, with the ordinary drugs, maybe also after transplantation. The transplantation surgery is always concentrated to only a few places. Here in Finland, it's only here in Helsinki. But please consider, those of you who are not experts here, that one transplantation involves 2, maybe 3 operations. The donor organ is harvested together with other organs for transplantation, often in another city. The recipient, the sick organ, is removed in some types of transplantation, like liver, heart, lung, and intestines, and then the new organ is transplanted in place. All these events together take around 15 to 20 hours or so. Here in Finland, we are proud to present already in 1971 the brain death was officially accepted. It was the first country in the world actually who got this. Transplant surgery has nothing to do with it, but the neurologists and the neurosurgeons were sick and tired of treating people at the ICU who were dead, in their opinion. They had to treat them still for days and days and maybe weeks. So they started that. We got presumed consent for organ donation 6 years ago. And of course, everybody follows the EU directive on organ quality and safety, which was given 6 years ago too. So here we are again. We are a member of the Scandiatransplant organ exchange organization, the Nordic countries since its start. And the attitudes, for instance, in Finland last year, 85% would be willing to donate own organs after death, even their children's organs, actually, which is a tough question. Now, our hospital here, we have 3 different places where the transplantations are done. The abdominal center and the heart and lung center are nowadays in the same building in Meilahti. And I'm the abdominal center surgeon, retired now, as I told you. And we do the adult kidney, liver, pancreas, intestinal transplantations and all organ harvesting. And then we have Heart and Lung Center, and Ari Harjula here is a representative for that center and will speak up to me. And then we have the Hospital for Children and Adolescents. We adult surgeons used to harvest the organs for them also, and then we do a combined transplantation. This is, I was about to say, my team, used to be my team, it's our team. These are the surgeons who have been working for the longest period altogether and transplant most of the organs during the last 30 years. In Meilahti Hospital, you can note that the abdominal organ clinic actually has 42 beds, which is not a small amount, because also the liver patients, the medical hepatology treated patients are there, and endocrinology patients also. So the number in Finland in transplantations are 355 2 years ago, and here we can see when the organ transplantation was started in Finland. We were country number 5 in Europe with the liver. Quality of life, that's what everybody tries to achieve with the transplantation. As much as possible back to your times when you were not sick, as much as possible. That's quite clear. And how do we succeed in that? Here to the left, there are listed 12 different things which are normal: sleeping, eating, walking, and so on. And the dotted line here is the line for the general population. If everything is 100% okay, then you go up here. And the solid line is for transplanted liver patients, which some of them, our qualifications are a bit less than the normal, but altogether it's quite, it resembles, and as I say, it's of the same magnitude actually as the normal, as the rest of the population. Please remember, the rest of the population is 100%, is not 100% okay. Most people have some kinds of dilemmas in their health. This is just how they go back to work, really, of course. The younger ones here, less than 30, more often clearly, but even those over 60 years, 20% of them go back to work after transplantation. So, the issues which are discussed during this symposium is what kind of person undergoes transplantation, any kind of physical activity beneficial for the health of the general population, that we know, and it has also been recently quite clear that that goes also for the transplant patients. Are there different ways to benefit from physical activity? Certainly there are. And in training, does it matter what organ has to be in transplantation? If that question would have been put 10 years ago, we would have said, yes, it matters, but it's less and less, it doesn't of any importance what organs has been. Clearly there are differences, but not that large ones as in the past. So what about the dangers of physical activities? That's for the doctors to check and the physios with you. So we know now, and it has been written down in the Finnish Kidney and Liver Association booklet, and also copied here to this organization's booklet for you, which also contains very, very detailed ways of how to train when you are in what kind of condition, very detailed. So it's easy to read, actually. And those are the positions here, actually. It even prevents side effects of anti-rejection drugs, so to speak. And you can see, of course, anybody who moves get less osteoporosis, one can say. And certainly it also maintains or increases your cardiorespiratory function. And for many, even more important perhaps, is that the body weight is easier kept in balance. And how is that accomplished? That you can read also in this booklet which you got here. There are really metabolic changes which the physical activity get into action. So, what is the experience so far? Any kind of physical activity is beneficial for the health of the general population and also for those who have been transplanted. This I would usually say many times and also today, and it's worth saying it. But when a physio program is planned, we should keep in mind why a person is transplanted with a new one. Why? Because anyone who needs a transplant has been seriously ill, really, or chronic or acute disease, and it takes a lot of guts, a lot of mental guts and physical guts after transplantation. You walk next day, maybe if you're lucky, but you don't run next day or next week or next month. So it takes time, a year or two maybe even. And well, you know, not all patients are happy with their life. Like this lady here complaining to this doctor that the drugs doctor, I think the dosage needs adjusting. I'm not nearly as happy as the people in the ads. Anyone from one of the companies here inside? Hands up. Oh, all right. I looked. Many of you know the results from the research literature. I looked up the very last ones, and the question which I put is: there a limit to physical training after transplantation? And this Spanish job showing no, definitely not. There's no limit actually, but that's an answer with modifications, clearly. And also, even on the waiting list, the second job here shows that even on the waiting list, it's worthwhile to do some kind of training, really. Even a short physical performance battery, you can look it up what it means. Just normally issues, predicts death or delisting from the liver transplant waiting list, actually. So that's why we have some conclusion, which I come to later. Clearly also, in particular in older people, if you have not done any training, certainly the results after transplantation for your medical condition is worse. I think everyone who has been transplanted has a fear. What will happen? Am I alive next day? Am I next week? Next year? And so on. And these fears, of course, has also been measured, and it's some kind of one of the many barriers, but the doctors and the nurses should be aware of that and take care of it, it doesn't go in too fast, but by time improves. Just a little bit again about the transplantation procedures. Here in the Nordic countries we have an organ exchange organization of our own, and about 20% of the organs are sent from one center to another within our Nordic centers. About 1,600 transplantations are performed in our countries, and only about 10 are sent to other organ exchange organizations, UK Transplant as it was earlier also, for instance. We have only one line. There's no green light for any specific persons, only for those which we have decided on beforehand. Those who are in kidney transplantation, immunologically problematic, and those who may wait for more than 5 years or something. Yeah, here you can see just how the organs are found, a more suitable patients perhaps in some other center. So one of the conclusions is, of course, which you certainly know, that's why you are here, that the physical activity is beneficial in transplant patients. But as a doctor, I want to give you this caution anyway. Don't get too fast in your training programs, because it should be correlated to your previous disease, which has left some momenta in other organs, and also the mental condition should be definitely improved before you start doing more physical activity than before the transplantation. And remember to be under the guidance of the professionals, doctors, nurses and physios. And you can also help other people in sports. I have an experience of my own. About 25 years ago I transplanted a liver to a man around 60. And I usually wait till 1 year until I tell the patients that if 1 year goes with flying colors, then they can lift their eyes over the horizon and plan their life for tens of years, possibility for tens of years ahead. He said, "Really? You say that?" Yeah. So he founded a football club, which 8 years later won the Finnish championship in football league #1. Not that bad done for another type of sports, actually. Yeah. So this is something you know all very well indeed, very, very well indeed. And if you are researchers and do studies, there are too many not so useful studies published. When you plan a research study in physical activities after transplantation or before, please discuss with the statisticians, because case reports are not so much helping for the rest of the world. It's good, it's fantastic for the person himself. We as doctors sometimes get carried away when we talk about our success, which is not our success. It's a huge team always in any kind of transplantations, definitely. And we should remember that we can not cure anyone for life more than a certain period. Our aim in treating patients with severe disease is actually only to prevent unnecessary death, and we hope to prolong life. So a patient really may wait for years before a suitable organ will come, and the training, as I repeat again, should start on the day they are listed. And then I repeat also again that the original disease and the condition clearly and also not only the physical but also the mental condition should be considered when you plan the programs. And don't forget the transplant surgeons and physicians. Some of us may be carried away when we train or do some sport, but they keep you on the right track and see to it that you take your drugs also well enough. We should also remember, in particular, since the guy from EU is here, that there's a position paper on transplantation and physical activity, which is was written last year. And one of the writers, authors, Dr. Totti, I don't know, is he here? Oh yes, she, sorry, yes. From Italy, right? The thing is, of course, to promote all these institutions and physicians to these programs. And it has been done. Italy was the first to fulfill this one, actually, and they have also written about this. Well, not only you as transplanted patients, few patients, but also we doctors, many of us who are here, used to compete. This is a so-called dragon race, which we had competed here, and our transplant surgeons and nurses actually won. There was a team that there has to be a team of 20 people, 6 of which were women, and there were competitors, 85 competitors, and we won by 0.2 seconds. Here is a guy, Sepolene, got a liver transplant more than 10 years ago before that, and he certainly had a lot of Olympic game medals and in good condition. Some of you may recognize him. This lady, about mental condition, very shortly. She was our liver transplant in Finland #2. 23 years old when she came for transplantation, and she had been ill all her life and spent in hospital half of her life, to 23. Last 12 months she was 7 times in the ICU with a hemoglobin around 40 and so on. I don't know what we did, but she not only survived, she had no complications. I can't understand that, because everybody got some complications, usually during the first months or years and so on. And she came to our checkups annually, and when she came to the 5-year checkup, I discussed with him and I asked, "How is your grandma?" She was the one who had been taking care of her. "How's your grandma doing now?" This girl had been shy for her life. She was looked always a little bit down, and she was very silent and so. But now she said to me, "Krister, you don't remember anything. When I was here 2 years ago, I said that she had died. Don't you understand?" I mean, she had become a vigorous, normal person, so I had to go around the corner and give her a laugh, because we have accomplished what is important. Quality of life was back. And a few years ago, she sent me a postcard from northern Finland and Norway, and you can see that she can take care of herself, right? So, physical activity for you or us, yes, certainly you do that and you can. Congratulations for your achievements, and we continue with this meeting. Thank you.